Hi, my name is Dr. Dana Harvey. I'm coming to you from Milton Chiropractic and Massage, just north of Atlanta. I'm going to talk to you about knee pain today because a lot of people present to the practice with knee pain, whether they're a runner or just an everyday weekend warrior or what have you. And the interesting thing about the knee is that it really is the circuit breaker between the ankle and the hip. Rarely do we see knee issues purely be a knee issue unless there's been a trauma or maybe a hyperextension injury or something of that nature. So what happens is the pelvis can get unlevel, so your hips start to get unlevel, or the hip can turn in or out, which changes the angle of your femur or that long thigh bone and how it matches up with your knee, and most importantly, the two bones of your shin. The two bones of your shin create like a platform for that femur or that long bone in your shin to sit on. So what happens is when you have torsional stress in the femur, or it's been turned in or out, it no longer matches up with those tibia and fibula of the lower leg as it's supposed to. So we often see people that are experiencing that knee pain, but it's really a hip issue, it's not the knee itself. Flip side of that is the ankle. A lot of people have had ankle injuries, whether they played sports as a child, whether they stepped off the curb wrong, whatever the case may be. They've had ligaments that have been overstretched or injured that are no longer stabilizing the ankle to hold its position when they're walking on an uneven surface, or they decided to do a pickup game of basketball at the age of 50 or what have you. So what happens is, as that ankle shifts, similar to like the hip, it now creates torsional stress in the heel bone. And in the heel bone, that's sort of the platform for that weight to be anchored all the way down to the ground. So if that's not sitting correctly, it is now affecting that tibia and fibula of the lower shin, therefore eliciting pain right where that thigh bone comes into those lower two bones of the knee. I'll take that one step further. And then we have patellar tracking issues, which is a knee issue as well, but a lot of times with those patellar tracking issues, because the patella is governed from the quadricep muscle as to how it moves, or that big muscle in the top of your leg, if that muscle is too tight based on pelvic position or a strain injury or what have you, growing, especially for the younger populations, females and males alike, sometimes causes a shift in that patella or a patellar subluxation because of that growth period and how tight that quadricep is. So what happens is, it's really not the knee itself. Again, it's that quad because of the hip or the growth period or whatever the case may be for the child or the adult that has had some torsional stress in the hips. So I hope that helps to gain some insight if you've been suffering with some knee issues that seem to be unresolved and you've been getting treatment on the knee. A lot of times it's time to look at something else. It's time to look at that hip, time to look at that ankle. So please reach out to us at mymiltonchiro.com. and we'd be happy to field any questions, or you can call the office directly at 770-751-9224. Thank you so much and have a great day.